Hi, welcome back to Talk of the Town. Well, as we all know, flu season is upon us. You may have it yourself. You may know somebody who does. Probably one of the two is true. I'm joined now by Eric Hewitt, who is the owner of the Medicine Shop in Monona. Thanks for being with us today.
Thanks again for having me back.
So some important information out there, news reports saying that the flu is in just about all 50 states. So let's kind of break it down. What exactly is the flu?
And I think this is an important distinction because a lot of people, think of the flu and they think it's a stomach issue, with the vomiting and diarrhea and stuff like that. That is not the flu that they're talking about. This is a respiratory illness. This causes coughing, fevers, headaches, all that kind of upper respiratory inflammation kind of symptoms is what they're talking about here. So it's an important distinction between the two. The flu that they're talking about, influenza, is actually a very serious issue and can cause severe illness, hospitalization, and even death in certain populations.
Oh my goodness. Well, obviously there's a lot that you can do, but it's challenging to know what to do. So can doctors prescribe an antibiotic at this point to, I guess, cure the flu?
An antibiotic, no. There is a couple of antiviral options, and that's an important distinction too. Is influenza is a viral illness. It's not a bacterial illness. So antibiotics only take care of bacteria. So you need an antiviral. That antiviral really needs to be started within the first 48 hours for it to really be effective. It doesn't necessarily treat it, it prevents the further spread of it. So it can kind of stop it in its tracks and let your own immune system kind of deal with it from there.
Sure. And if you're talking about you're living under the same roof of your family and children, that's an important step to be able to take if you can catch it early enough.
Absolutely.
But since we can't take an antibiotic to cure it all the way, and that's not going to take care of it 100%, the antiviral, let's talk a little bit about just easing the symptoms, managing the stress of how bad you feel.
Absolutely. A lot of the things is, things that you've always grown up hearing. Make sure you increase your fluids. Get some rest. Try not to just, make it a part of your daily lifestyle. Not only because you can infect other people, but you're going to wear yourself down and not let your body take care of it yourself. And then for the over-the-counter things that can help with maybe fever and chills and some congestion and things like that, come into the pharmacy, ask the pharmacist. We can help you navigate through what would be best for your specific symptoms.
Yeah, and they can vary so much because there's so many different types of the flu out there. So it really is helpful to talk to an expert that can guide you to the right thing, because to me, when you're sick, there's nothing worse than trial and error and spending all this money on the wrong thing, and then it doesn't work anyway. So
and we're happy to help, come out to the front and go through each individual item for you, show your options so you're best educated for what would be best.
Yeah, that's really nice. Let's talk a little bit about the flu shot and how helpful is this in treating and or preventing the flu?
So that's the other thing that I've heard on these news stories is that the flu shot, unfortunately, this year is not quite as effective as they were hoping it was going to be. However, it still can reduce the severity of the symptoms that you get if you get the flu. So it may not prevent the flu from invading your body, but if you do get it, you can still, kind of have a much less severe case of it because you got that flu shot and have that protection.
Okay, so any reports of it being ineffective, not really the case.
That's kind of a strong term. It's not as effective as, what they were hoping. It still has effectiveness. Yeah.
Great, okay. Let's talk before we head to break about any other information that people should know if they do contract the flu.
The biggest thing is that when you have the flu, you can very easily infect other people. So that's the biggest thing, is being aware. It's not just staying home from work because you don't feel well. It's also not spreading it through your workplace or spreading it through your home or to your loved ones, especially those most high-risk populations, the elderly and the very young.
Yeah, you bet. Take care of yourself, not only for yourself, but for your loved ones and your coworkers, so you can get better, and hopefully we can keep it to a minimum.
Yes.
But boy, it's tough. It's affecting lots of folks.
Yes.
Well, thanks for sharing that with us. Again, this is Eric Hewitt, the owner of the Medicine Shop Pharmacy in Monona, our news partner. And this is Talk of the Town. We've got more for you coming up after the break.